Hello everyone, today is April 3rd. My topic is this coronavirus pandemic crisis may be an opportunity for Canadian healthcare system to reform. We can talk about why and how. Before this pandemic, I was studying in the UBC healthcare administration program, and we have been debating and discussing how to reform Canadian healthcare system. Because really, for example, in British Columbia, our healthcare system was already on the edge of collapsing even before this pandemic. So now, when there is a big healthcare crisis, we can see a lot of problem emerged, obviously. So first of all, we don't have enough hospital or facility healthcare facilities, right? Or ICU beds, for example. Second, we don't have enough essential medical supplies like N95 masks, ventilators, or even medications like from our own country. When other countries cut the supply to us, we have nothing. And then we don't have enough healthcare professionals, like doctors, nurses, and other professionals. So why those shortage happened? The reason I think is it has been a long time. The Canadian healthcare system is solely controlled by the government. No private sector or private capital can get in the hospital, public hospital healthcare system. It doesn't allow the private capital to invest in this industry. And another reason is the government are reluctant to encourage the local business to innovate or manufacture those essential supplies in the local province or in Canada. But on the other hand, the government want to control everything, but they don't have enough money. They don't have enough resources, or they don't have either energy or incentive to change. I think the government, Canada is a rich country, but the Canadian government is a poor government. They are barely surviving the budget. So with very limited resources, expertise, and the money, they still want to control everything. So my argument is we can, in this opportunity, there are so many problems cannot be fixed by the government, by the public system. Maybe we need to reform. First of all, we need to break the monopoly. For example, increase the number of medical students enrollment, right? Increase the positions of doctors. That part is monopolized by the College of Physicians and Surgeons. They are the gatekeepers. They don't allow more people become doctors for obvious reasons. And then we need to allow private capital to invest in providing healthcare, for example, facilities and also equipment. And when you have more supply of service and also professionals, that will meet the demand of our people's healthcare demand. So that may balance better. So instead of we have limited supply, so when there is a big demand, will collapse. And also we need to encourage, I think the government needs to set up policies, encourage Canadian entrepreneurs to set up factories, companies to innovate our healthcare, medical technology, and set up factories to produce essential health supplies, products, or drugs to our Canadian hospitals. For example, masks, gloves, ventilators, medicines. We have all the raw materials. We have all the natural resources in Canada, and we do think we have the technology and equipment, but we just need a policy to encourage those entrepreneurship in Canada. So we are in the middle of the crisis, but I think we should start to think or start to take actions to change our public healthcare system, which is collapsing. That's for the good of our people. Thank you.